So I wanted to talk a little bit about training considerations for an individual with a confirmed spondylolisthesis. And I recently had a college football player who was having long-standing back pain. They did not have a traumatic mechanism of onset, and it wasn't radiating or sending anything down into the legs, but they just had persistent long-standing back pain. When they went to the orthopedic and they got imaging done, they ruled out anything from a disc pathology, anything that was neural related, but what they did end up finding was that they had a spondylolisthesis. Now, it wasn't to the degree that the individual needed to entertain surgery right off the bat. They were given the go-ahead that it was structurally stable enough and appropriate enough for them to continue playing as tolerated, but the surgeon did say if this was something that did not get better or did not progress, it was significant enough where they could justify surgical intervention. So with this athlete, when we were going through their training, I think we really needed to figure out if they're playing football, and oftentimes it was exacerbated with sprinting, it was exacerbated with weightlifting, and it was exacerbated with contact and hitting. So what we needed to be mindful of is if we cannot modify some of their demands of just what they have to encounter in sport, we need to really be intentional with what we're exposing them to outside of their sporting environment where we have full control over their strength and conditioning. So a couple things that we did to modify their programming, instead of having them do back squats, we switched primarily to either heavy goblet squats or rear foot elevated split squats, or we did something where we would have heels elevated so that way it was easier for them to maintain an upright posture from a positional standpoint, taking some of the pressure off of the back extensors. And we also found ways to load them without directly axial loading through the spine. So with this athlete, they actually did very well with the rear foot elevated split squats, and with them being a receiver, I think the most important thing that they're doing is just training leg strength, but we don't need to worry about having them actually lift the most amount of weight possible. So their sport is not, or their position in their sport is not dependent on them being the biggest, strongest individual in the field. They just need to be big and strong enough to be effective at their position. So luckily for them, between doing rear foot elevated split squats and some other single leg variations and bilateral but asymmetrically loaded variations, we were still able to get a training stimulus that met the demands of their training needs and not compromising some of their tolerance or just safety with the exercise. Other things that we looked at was with their core training. Instead of taking them through large degrees of flexion and extension and rotation, we often kept them in relatively static positions or neutral positions of the spine, and we focused more on doing anti-extension and anti-rotation with this individual. So that way we're able to train anterior core, we're able to train rectus abdominis and work on minimizing the amount of extension demands and moments going through the back. We're able to work on internal and external obliques and going through different, training the muscles that will help them go through rotational tasks, but without actually asking them to extend or rotate into some of those painful positions that they get into that they're already encountering on the field. The last thing that we did with this athlete was making sure that from a plyometric standpoint, so when we're introducing activities that had more of an impact component to them, we tried to minimize the impact as much as we could without detracting from the point of the exercise. So what I mean by that is when we were doing some of our jumping related tasks, especially a lot of our vertical jumping, if the intent of the task was to jump as high as possible and to maximize force production and propulsive demands with this athlete, then we had them do box jumps. And we found ways where we could work on them getting as much vertical displacement as they could, maximize force output, but having them land on the box so that way they weren't coming all the way back down to the ground and having to deal with the impact and the absorptive demands of the activity. Other things that we did with the individual is sometimes we just made the plyometric activities a little bit more complex. So some single leg variations or some multi-directional variations to them where they're inadvertently going to have to pull back some of the intensity with the exercise to accommodate for the complexity of the task. So Those were just some 3 easy things that we found that we could do with that individual, where modified their plyometric and their impact training. We modified some of the positional demands that we did with them with their core training to reduce the amount of extension and rotation they were going into. And then we also found ourselves modifying either the weight placement when we were externally loading them, maybe transitioning from a barbell to dumbbells or kettlebells or even some med ball work, and just allowing them to avoid either the direct axial loading or just putting the weight in a manner where it's going to disperse either their center of mass or the overall external load in an area a little bit friendlier than directly through the spine or targeting back extensors.